Okay, I take this opportunity now to present the project work that we did on hospital management system using Microsoft Excel. And without much wastage of time, I would like us to go into our project work. And let us look at our first sheet, which is the sheet of hospital details. Now, in this sheet, we have the title of our medical center and the services offered. That is from the chemotherapy services, the x-ray services, family planning services, dental services, maternal services, optical services, surgical services, ear checkup and treatment services, voluntary counseling and testing services, that is the VCT services, the laboratory services, and the pharmacy services. From there, we go to our second sheet, which is the sheet of doctors' details. Now, in this sheet, we have the registration numbers of the doctors, as well as their names, their date of birth, their gender, their postal address, their ID numbers, as well as the departments in which they specialize into. Our third sheet is the drugs sheet, and in our medical center we have different types of drugs that we administer or offer to our patients and their respective prices. That is, we have the drugs here and their prices are indicated as listed below. We go to our next sheet, which is the patient registration sheet. In this sheet, we have the names of our patients, their registration ID, their phone numbers, the date in which they were admitted, the rooms in which the consultation took place, the room type in which the patient is admitted, as well as the room type fee, and finally the registration fee. For every patient who comes to our clinic or our medical center, in order to be registered, he or she must pay a fee of 200 Kenya shillings so that he or she may be given the registration ID number. From there, we go to our next sheet on patient details. Now, in this sheet, we have the general details of our patients. We have their names, their dates of birth, their postal address, the registration ID numbers, the gender, the age, admission date, and the date they were discharged, as well as the days spent, and also the time admitted, time released, the diseases in which the patients are suffering from, the disease status, that is, if the condition, that is the disease of the patient, if the condition is severe, if it is well, if it is good, if the condition is more severe or excellent, or if the condition has led to death. We go to our next sheet, which is the sheet of room information. Now, in this sheet, our clinic, that is our hospital, the hospital has different types of buildings. That is, it has building A, building B, and the building C. And in these buildings, we have different room types, ranging from the VIP rooms, the regular rooms, and the normal rooms. The room types are based according to the standards, the living standards of the patients who come to our hospital. We also have this column of the room numbers. Each and every room, it has a room number. That is from room number 71 all the way to the room number 31. And also in these rooms, the rooms have beds, and